senior government officials here present, dear Kathy Maggie, co-founder and president and the CEO of Operation Smile, distinguished guests and partners, dear surgeons and future surgeons. On behalf of His Excellency Paul Kagame, President of the Republic of Rwanda, I am pleased to join you today at this important conference on surgical care in Africa. Together, we are here to discuss the urgent challenges in surgical care, workforce development, and innovation to transform healthcare across the continent. Surgery is not a luxury. It is a fundamental pillar of healthcare. Yet 70% of the world's population lack access to safe, timely, and affordable surgical care. Africa, home to 24% of the global disease burden, has only 2% of the world healthcare workforce. This imbalance costs us lives every day. Rwanda has for long recognized the critical role of surgical care in achieving universal health coverage. Today, we are building a roadmap to further expand surgical capacity, invest in training, and ensure access to life-saving procedures for all. The government of Rwanda is also making efforts to increase the healthcare workforce, including surgeons. In this regard, we are upgrading and expanding teaching hospitals closer to communities. Our aim is to ensure that the next generation of surgeons is trained in settings that are geographically accessible to the populations that need them most. A tangible success story of this effort has been our partnership with Operation Smile. Through this collaboration, we have observed a notable progress in our plastic and reconstructive surgery workforce. We commend the impact of this strategic partnership in promoting the capacity of our medical workforce. This partnership has also demonstrated how investments in healthcare services can drive sustainable change, not only in Rwanda, but also across the continent. Additionally, Rwanda has a partnership with IRCAD Africa, a globally recognized center for surgical training and innovation to train African surgeons in minimally invasive and robotic surgery. This collaboration equips our specialists and trainees with cutting-edge surgical techniques and improve patient outcome. Beyond workforce development, we must adopt innovation in surgery, such as advancing surgical education across Africa, leveraging telemedicine and other modern technologies, building safe surgical ecosystems, as well as strengthening research and academic excellence. Therefore, this conference must be a catalyst for action, not just another meeting. With our renewed shared commitment for a resilient and sustainable surgical services in Africa, let us commit the following. First, we must ensure that our communities have access to affordable surgical services and at their nearest healthcare facility. Second, it is important to expand the surgical training programs to build a resilient workforce. And third, there is a need to improve health equity so that no patient is left behind. Our distinguished guests, as I conclude, I would like to thank Operation Smile and the other partners for collaborating with the government of Rwanda to organize this conference. Your contributions are very important in shaping the future of surgical care across the continent. Let's use these days to share knowledge, forge partnerships, and take decisive steps toward building resilient and sustainable surgical systems in Africa. On this note, it is now my pleasure to declare the Pan-African Surgical Conference officially open. I thank you so much.